Okay, I think we're going to go ahead and get started. Thank you all very much. Good evening. Welcome. Glad you guys are all here. How many people have been at some classes for the pre-conference classes so far? Good time? Did you guys enjoy those? Excellent. My name is Michael Villaire. I'm CEO of the Institute for Healthcare Advancement. We're the ones who are bringing you this party, and thanks for being here tonight. We are going to talk about Health Literacy 101. How many people have how many people have listened to this lecture already in a previous year? Nobody? Oh, good, because I was going to say, spoiler alert, it's the same as last year. Good. So the reason we do this is because we have a lot of people who come to the field who either just like to get a little refresher or who are a little bit newer to the field and, sort of like, oh, we've heard all the statistics, but we kind of want to get a good understanding of what is this issue of health literacy, what's the scope, those sorts of things. So that's what we're going to do tonight. So on with the show, as they say. So it's always a good idea to kind of set our expectations for what we're going to do during this course. So this is our version of that. And as in health literacy, when we try to manage those expectations and introduce things ahead of time so that people have a little better mental grasp of what is going to be required of them, same thing here. And so for tonight, we're going to take a look at a few things. We're going to define health literacy and describe the prevalence of poor health literacy or limited health literacy in the United States. We're going to talk about the general characteristics, the abilities and the challenges of those with poor health literacy skills. And we're going to describe a couple of reasons why health literacy matters in the healthcare system. A couple of housekeeping rules first, if we can make sure our phones are on mute or on a no ringy setting. If you have questions, let's go ahead and do those during the course of the talk. Do me a favor, raise your hand real high. I don't have great eyesight, and also the lights are kind of in my eyes. So if I'm not responding, just start waving. Jumping jacks work too, but just let me know, and we'll try to get to those questions. So anything before we start? Great. Okay. So when we're talking about literacy and health literacy, one of the questions that immediately comes up is, well, health literacy, is that kind of like literacy? Is it just a different version of that? There are shared characteristics, but they are not the same thing. So when we talk about literacy, there's different definitions of this. This one is as good as any, using printed and written information to function in society, to achieve one's goals, and to develop one's knowledge and potential. Really, literacy is kind of about your ability to read and write. It's your ability to kind of understand the messaging and everything around you and to function within society. So health literacy, a little bit different. A lot of definitions around this. This is, frankly, once you've been around in the field for a little while, you'll know one of the controversial or less agreed upon areas of this field is what actually is the definition of health literacy. I think there was a paper published a little while ago that listed 24 distinct definitions of health literacy that have appeared in the peer-reviewed literature. So we're having a little trouble falling on one of them, but there's a number of these ones that we use. This one by Scott Ratson and Ruth Parker. This appeared in the IOM report. This appeared in the Affordable Care Act. And it's a little bit of an earlier definition, and so according to this one, health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. So it's kind of your ability to interact with and appropriately use the healthcare system, okay? Now, a couple of other definitions. This was from the AMA Council on Scientific Affairs. Another way to look at this is the ability to read and comprehend prescription bottles, appointment slips, and other essential health-related materials required to successfully function as a patient. How many of you have taken that course? How to successfully function as a patient? It's kind of from the school of hard knocks, isn't it? Here's one way to think about health literacy. Most of you in the room, I am assuming, are affiliated with or a part of the healthcare system to some extent. I think that's a reasonable assumption to make. Anybody who's not? Okay. So you work in this area. You know it. It's sort of what you do. It's what you're paid to do. It's what you've studied to do, and it's what you do on a daily basis. A lot of people aren't. Okay? And so when they interact with the healthcare system is usually when they get sick. And usually that's kind of a time of higher stress. Okay? Here's another way to think about it. Finance literacy. How many people are really familiar with the finance system? Who can identify or give me a definition of what the Dow Jones Industrial Average is? Okay, Mario, our IT director. Oh, you're just reaching up to the camera, never mind. What's a derivative? It's like, I have no idea. I put aside some money. I hope it grows. When it falls, I'm sad. When it goes up, I'm happy. And that's about the extent of it. Same sort of thing with health literacy in the healthcare system, although I think in some ways the stakes are kind of higher. So there's another definition for health literacy that a lot of us tend to favor, and there's a few that are a little more along this line. But what it really does is it brings in both sides of the equation. So there's the people who use the healthcare system and the healthcare system itself. So this definition says health literacy allows the public and personnel working in all health-related contexts to find, understand, evaluate, communicate, and use information. Health literacy is really about the demand that we are putting on individuals as a system and their capacity to be able to meet that demand, all right? So if I ask you, go over and lift that 400-pound safe. Well, maybe there's a few of you who could. I certainly couldn't. That's an unreasonable demand. It's not something that we can do. And a lot of times that's sort of what happens in the healthcare system. We use our own language, jargon. We forget that people don't really have the same sort of training and understanding of a lot of the terminology and processes that we do. And sometimes we make sort of unreasonable demands. If somebody reads at a 5th grade reading level and we've given them a brochure that's written at a 14th grade reading level, that's an unreasonable demand because they can't read it, okay? And believe me, that happens quite often. So think about it in sort of those terms. It's that where can we kind of make that level playing field? That's our goal, that's our vision, where everybody's sort of on the same level and we're talking and communicating in a way that everybody understands and can act upon. So what comprises health literacy? Reading and writing, so we talked a little bit about that. To what extent are the requirements and the information that we're giving to people things that they can actually read? So if they can read at a 5th grade level, that material needs to be written at a 5th grade level. It needs to be an active voice, something that's actionable, understandable. And when you give it to them, they can read it, they can understand it, and they can go out and do that, and they can ask questions about it. When it's beyond their ability to read, it's going to go in the garbage can. I don't care how pretty it is. I don't care how much that photo cost me. And that graphic designer worked on that for 14 hours. That's great. It's going in the garbage can. Listening and verbal communication, and this is really between patient and provider. There's different kinds of communication. Right now, we're not having a conversation. This is a lecture. I'm talking directly to you, and although if you have a question, you can raise your hand. This is not a back and forth conversation, right? So this is a one-way dialogue. A lot of times where we really get to the heart of health literacy is when we have those back and forth dialogues, and we ask people, we kind of test for understanding, we ask them to repeat back. How many people went to the teach back session a little earlier today? Okay, so that's one of our tools and techniques for really understanding that. Numeracy. We're going to touch on numeracy a little bit more in our talk today, but numeracy is probably one of the most difficult aspects or dimensions of health literacy. When we are discussing things that have to do with numbers, ranges, things like asking people to add, subtract. If I say take one pill 5 times a day, when do you take that pill? When do you take that pill? Every 4 hours. Okay, so that's 5 times 4 is 20, and that's 24, and we're sleeping, so we don't want to wake up and take a pill. But there's a computational aspect in there. All right, so if I take it 5 times a day and I take it every 4 hours, I wake up at 7, so I take it at 7, take it 7 plus 4, I take it at 11. 11 plus 4 is 15. Oops, wait a minute. Oh, we have a base 12 system. First roadblock. All right, so you can see there's opportunities for misunderstanding and miscalculation here. Interpreting and evaluating risk. Risk is one of those things that is completely abstract. It's chances. It's the likelihood that something is going to happen, right? So if the doctor says, well, I don't smoke, but if the doctor said, Villaire, you got to quit smoking. If you keep smoking, you got a 75% chance of getting lung cancer. Okay, what does that mean? Well, does that mean 75% of my lungs are going to get cancer? No. What it means is that people who smoke as a large group, and we test all of those people, our statistics tell us that 75%, and I'm just pulling the number out there, but 75% of those people get lung cancer. These are just epidemiological statistics, right? But it doesn't apply directly to me at all. I could or couldn't get cancer. It's going to depend upon a lot of different factors. But what's another way we could communicate that? Maybe we could be a little more visual. So we could say, Villaire, for crying out loud, you got to quit smoking. If you keep smoking, your chances of getting cancer are up here. But if you stop smoking, your chances are going to be a little more down here. Okay, that's a comparative sort of analysis, and I can wrap my arms around that one a little better than 75%, okay? There's all sorts of examples of this in the literature, asking people to see if a lab value or something is within a certain range. So like 10 to 50% is normal, you're at 42%, are you normal? We immediately process that and we think, oh, okay. But not everybody's mind works the same way. Some people are much better at concrete sorts of things and just are not good at numbers. How many people are really good at math, really good at numbers? Yeah, there's a couple of hands going up, but frankly, as a group, as adults, we're not great at math, and that's okay. It's just one of those things where we need to understand that dealing with numbers, risks, percentages, ranges, all of those kinds of things, those are difficult concepts. And we need to remember that because those are the building blocks upon which people make decisions and move forward with their care and their own self-care. So we need to be very careful about that. Self-efficacy is that ability to understand what's required of one to do something and the ability to carry that out. This is very much a component of health literacy because that's really what we're talking about. It's that ability to understand, process, and act upon the information that we give. And what really mediates that is how we as the healthcare system present that information. So over the course of the next 2 days, hopefully you're going to hear some really good examples about that. You'll learn some skills and we'll really get into that. A few other considerations, culture and belief system. I think I could sit down and have a little interview with everybody in the room, and nobody's life story is going to be exactly the same. That's the way it's supposed to be. That's great. That's why we're a big, diverse group. Some people, their belief systems, their culture is just completely different from what our expectation and our experience is. There's a book, how many people have read this book called The Spirit Catches You When You Fall Down? Excellent, excellent book. If you have not read it and you're looking for a good read, it actually just kind of reads like a novel, but it's a true story. The Spirit Catches You and You Fall Down. It's by Anne Fadiman. And this is it's a true story of a Hmong, H-M-O-N-G, Hmong girl in, was it Modesto? I think it was Modesto. Or Fresno? Fresno, thank you. California, and I think this was like in the 80s or something. And so they come from that particular culture. And the daughter she was like 3 or 4, and the daughter had a seizure. And they brought her to the local community hospital emergency room. And so she had some tests, and the doctor said, she had a seizure, here's the medicine, make sure she takes it once every, whatever the amount of time was. As it turns out, that wasn't part of their belief system. In their culture and their religion, they believed that the seizure was a result of a loud noise frightening her and her spirit leaving her body and an evil spirit catching it. So that's the title. They said she's sick because the spirit catches her and she falls down. And so the whole book is the story of these two cultures, Western medicine versus the Hmong belief system, clashing. And unfortunately, the person on the losing end of that was the little girl. But they never tried to take that moment to stop and listen and understand and try and find that common ground. So culture and belief systems are very, very important when we're in this whole process of trying to communicate. A mismatch between provider demand and patient skill level. What am I asking you to do? If I'm asking you to make sure you start having 4 servings of fresh fruit and vegetable in your diet every day, and you live in an area where you don't have access to fresh fruits and vegetables, I'm making an unreasonable demand because transportation may be an issue. The cost of those fresh fruits and vegetables may be an issue. And just getting there, maybe you're in a wheelchair and you don't get out of home and you have a Meals on Wheels delivered once a day and that's your meal, okay? So what are we asking from people, and what is their ability to meet that? We talked about the mismatch of reading level and materials. There's statistics that we'll get into a little bit later that show that there really is still a mismatch on that. Health literacy has a strong relation to health disparities, those things that affect certain people because of things that are either as a result of where they live, who they are, or restrictions that have been put upon them, okay? And also a strong relation to safety and quality. If you are looking to convince if you work in a hospital and you want to start implementing some of the things that you learn here, and you make a request, and somebody in your department says, "That's nice, but we really don't have any money for that," say the two magic words: safety and quality. I guarantee you, if you work those into the equation, your chances of getting your funding are probably going to increase a little bit. So here's a little graphic that talks about equity and equality. So what do we see here? In the first one, everybody has the same size box, right? That's equality. So we're treating everybody equally. Well, guess what? Some people have different needs than other people. So the young gentleman on the right there, he's been given a box, he or she. That still doesn't help because it's not quite enough. The young man on the left there probably didn't even need that, but it's a system of equality, and so everybody has gotten the same thing. So equality is a good thing, but sometimes it's not what's needed. Equity is in the middle, saying we're looking at the outcome. Who then has access to the same thing? And access in this case means being able to view the ball game. And what does it mean to be able to provide everything so that we achieve a sense of equity? That's the middle one. So now everybody is seeing it at the same level because we've given people different things based upon their needs. The third picture is really kind of where we hope we would go, which is sort of a social justice picture, where we just remove the barriers, all right? Let's don't worry about how do we equip people to overcome the barriers. Let's just remove the barriers, all right? So let's keep that in mind. This next piece is what I call an empathy exercise. This is just a way for us to sort of say, how do we get ourselves into the shoes of the person who has limited health literacy? How do we experience that so we can kind of know, how does it feel to be in that circumstance? I think we talked a little bit earlier about just about everybody here is in the healthcare system, right? Doesn't mean you all have great health literacy. It absolutely doesn't mean that at all. But it means you have an understanding of a lot of things that are about the healthcare system that a lot of other people don't. And people who don't are at a distinct disadvantage. So for this exercise, I'm going to read a paragraph. And you can either close your eyes and listen or go ahead and read along, either one. But let's put some stakes on this, all right? So here's the stakes. I'm going to read a paragraph. And if you, after that paragraph has been read, if you understand and comprehend everything that has been said, you are going to live. If you don't understand what has been said, the alternative, you are going to die, all right? Are you ready to live or die, everybody? Here we go. All right. Oh, I didn't know. I didn't sign up for that. Okay. So here we go. So I got this from online from a nuclear physics journal. How many people are nuclear physicists in the audience? So we got, oh, come on. There's always have one wiseacre raises his hand. Come on. Who's a nuclear physicist? We have one? No? No? Okay. You guys are a pretty serious crowd here. Okay, good. All right. So I'm going to read this paragraph, and at the end, we're going to take a little test and see who understood what this actually says. Are you ready? All right. Transverse and longitudinal response functions have been extracted for helium-3, carbon-12, calcium-40, calcium-48, and iron-56, up to a momentum transfer of 550. The quenching of the longitudinal response function in the quasi-elastic region is significant and might be a signature of modification of the intrinsic properties of the nucleon in nuclear matter. Thank you. Who's going to die? Now, all joking aside, when you heard this thing being read, I'm guessing there were words that you understood, discrete, separate little words, right? The sentence cadence, you were kind of like following along. But the message, the context, what is this paragraph actually saying? What is the message that is meant to be imparted to you, and what does it mean to you? We can't discern that because the language and the terminology that's being used is meant for a certain audience. This language is meant for nuclear physicists, and to them it's like, oh yeah, of course, I knew that, right? But for the rest of us non-physicists, it doesn't resonate. I have a degree in English. I worked for 20 years as a managing editor of peer-reviewed journals, so I understand certain things. I can diagram a sentence. I understand the parts of speech. I can go through here and tell you what's the subject, what's the verb, what's the the clauses, what are the articles and prepositions and all that sort of stuff. But I can't tell you what this whole thing means. I can break it down and understand little tiny pieces, but not the whole thing, not the message. This is what happens. The same feeling that you have after hearing that paragraph is what happens with a lot of people when they go in for a healthcare encounter and they're given a message that's not directly meant or tailored for them. We're either talking above them, we're talking in a language that is not their first or second language, and we're just using words that people don't understand. So if you take nothing else from this talk tonight, I hope you take a lot, but if you take nothing else, think about how that feels to have been read a paragraph and just be like, I have no idea. That's how a lot of the people with whom you interact feel on a regular basis when we try to talk to them, give them a piece of paper with information that they don't understand, or just try to communicate with them without really understanding what their ability is to understand and act upon that message. My doc says 1 glass of alcohol a day. I can live with that. Yikes. Part of health literacy is being clear and concise. So when we say, take 1 pill 2 times a day, I can take it. I can go brush my teeth. I can come back and take another one. I've taken 2 pills. I took them 2 times in 1 day. Probably not how the prescribing doctor meant for you to take it. But he or she was not specific about how to take that. So that was left for interpretation. This gentleman enjoys his King's double supersized glass of whatever that is. Likely he'll probably be dead after he drinks that, but this is just an extreme example of us not being terribly clear when we communicate. It's incumbent on us to really be clear when we communicate. So here's a few examples. An 89-year-old man with dementia, diagnosed with an ear infection, prescribed an oral liquid antibiotic. His wife understands that he must take 1 teaspoon twice a day. After carefully studying the bottle's label and not finding administration instructions, she fills a teaspoon and pours it into his painful ear. Some groups, when I tell this story, they're like, oh my God, that was so dumb. But was it? What was she acting upon? What information did she have? What was written on the label, right? That was a reasonable guess. The ear hurt. Didn't say take it by mouth. It just said 1 teaspoon. How many? 1 teaspoon twice a day? Right, so she gave him 1 teaspoon. Again, let's be aware of where our communications are falling down. In all honesty, when we talk about health literacy, we're the authorities, right? We're the ones who know a lot. We need to be really aware of what people's ability and capabilities are. We need to take the higher ground and take the responsibility and make sure that we're being as clear as possible so that people can actually understand and take care of themselves. And we don't have mistakes like this because these happen. These just happen, and they happen all the time. Mr. G, 45, Hispanic immigrant, native Spanish language speaker, has a job health screening. He's told his blood pressure is high and he can't work until it's controlled. He's given a beta blocker, diuretic, and instructed to take each once a day. 1 week later, presents at the emergency department. His blood pressure is very low and he's dizzy. The docs can't figure it out, so one of the people there who speaks Spanish asks him how many pills he took each day. 22, says Mr. G. In Spanish, once means 11. And so this gentleman, Mr. G, read the one word on that label that he could understand, once, all right, and he took, that was 11. And so that's what he took. All right, once a day, once. We have to understand again, that there is room for interpretation. And our goal is to clarify that so that there is one interpretation and it's the correct and the right one. Teaching hospital, an intern writes in a patient's problems section, the part that says patient problems, section of the medical chart, speaks no English. The attending physician writes a note back in response, your problem, not his. The fact that those whom we are serving do not understand the language in which we present to them is not their problem. It is a barrier. Okay? It is something that is getting in the way of our being able to communicate directly and clearly with them. If the patient or the person, the client, whoever we are working with, doesn't speak the very same language as we do, then it is our responsibility to find a language access person and somebody who can interpret for them. All right? Because the fact that somebody doesn't speak English is not a problem. It is a barrier, it is a challenge, and it is our responsibility to figure that one out. We're going to take a look at a short video. How many people have seen this video? This is the AMA video, Help Your Patients Understand. This was produced a number of years ago, but it's still very valid. And all of the people that you're going to see in this video are real people. There's no actors. The clinical staff are doctors. The patients or the people that they're doing the interviews are folks. So it runs about 5 minutes. What I would like for you to do is watch this video, listen to what the people are saying about their relative inability to understand. So all of these people have some sort of literacy challenge. Either they read at a lower grade reading level or what have you. So you'll see this is so-and-so, this is what they do for a living, and this is the grade level at which they read. So they're going to talk about some of their experiences. What does it actually mean to interact with a system when you have a little bit less than proficient literacy and health literacy skills? So let's go ahead and start this. And then I just want to get your impressions about what you thought about this video when we're done, all right?
Missed dosage and didn't realize it. I was in the hospital a lot. When they did give me medicine, I didn't take it right. I admit to it. I just didn't understand them, and I didn't have the nerve to ask them the right way of doing it. I just didn't have the nerve to ask them, and I didn't want anyone to know I couldn't read.
We had a child that was physically handicapped that I had to do physical therapy on. I would show up on Tuesdays instead of Thursdays for the appointment. I would be exercising the wrong side of the body.
I had an abscess in a ear one time. Well, I had to fill out forms and I couldn't fill out, so I didn't go. I come back home. I ended up having to go to the emergency room that night because it burst.
Can you imagine what it's like, you being a patient and sick, and you know that you have limited skills, okay? And you're talking to an intelligent doctor like yourselves. And these people are using words that you really don't know because they're not speaking in layman's term, okay?
Right.
Most doctors are just presuming that everybody's intelligent as they are, and that is just not the case. So what you do, you come out of that room, that examination room with this intelligent woman or man thinking, God, I hope I don't make a mistake with my medicine because I did not understand anything he or she said to me.
One capsule.
That's right. One capsule.
One capsule. I don't know what this is.
Twice?
Twice daily.
Okay.
Okay.
So how would you take this?
Well, now see, it's not on there telling you how to take it. It say take it twice daily, but it don't say what time to take it.
Which one is which and what you take them for?
That looks like my medicine that he gave me for the morning. I take that and the little pill that, well, this is this is Lipian, isn't it? Yeah, that's Lipian.
Okay. And what do you take that medicine for?
Don't ask me. He puts me
Okay.
on there and I just take it.
Okay.
Anything he tells me to take, I'll take it.
Okay. So you trust him?
Oh, you better believe it, my life.
Hypertension means, if I asked you what that was? Because when I look at this, I think, well, maybe you have hypertension, and I've been taking care of that for a long time.
Hypered? Hypered?
Like you're hyper? What does being hyper mean to you?
That's where you can't be still. You always got to be doing something.
Do you think I think you're hyper and have hypertension?
I don't know. That's what I consider it.
Okay.
They're being, you know.
Okay. But you know you have high blood pressure.
Mm-hmm.
Okay, but hypertension doesn't mean the same to you.
Mm-hmm.
So if I ask you if you have hypertension, you're going to just think, I think you're jumping around on the chair or something like that, something different.
Just being hypered, you know.
Okay. All right. Well, I haven't done a very good job teaching you what hypertension is, because I think you take that medicine for your hypertension, and that's one of the things that I try to work with you on is your blood pressure. And high blood pressure and hypertension, to us, is the same thing.
The same thing.
At approximately 30 or 31, I went into the gynecologist and complained about part of this not working correctly. And he said, we can repair that. Great. I didn't ask all the right questions. When I showed up 2 weeks later at the admissions office at the hospital, they put enough papers in front of me. I'll bet there were 5 papers that I needed to sign. Well, I wasn't going to say, excuse me, but I don't read really well, and I certainly don't read fast, and I'm concerned with some of these words. To me, it was lines and circles over sheets and sheets and sheets. And I wasn't going to reveal my sense of stupidity, so I signed everywhere they told me to sign. Never read it. And then a couple weeks later, in the follow-up office visit, the nurse said, how are you feeling since your hysterectomy? Now, I acted as normal as I could. Inside, my mouth fell open, and I thought to myself, how could I be so stupid as to allow somebody to take part of my body, and I didn't know it?
If you have a reading problem, you go to the doctor. That can be very scary. It's like a nightmare. You walk in that office, and most people, if you realize the first thing you're going to have to do if that's your first visit is fill out a form. Your heart beats real fast. You're scared. You don't know what to do. You want to turn around and walk out. I have.
You have panic attacks. Did I do it right? Is this done right? Am I imagining things? Do I go back over and check it again? I've caught mistakes that I made, simple mistakes.
It paralyzes your thoughts completely to think that you may say something or something is put before you to read and you can't read it. I mean, you live with that on a daily basis.
People sooner or later will discover, and that is your most greatest fear. Mm-hmm. What day is it going to be when somebody discovers you can't read and write?
I would get mad about something and blame them that this is not the right place for me, you're not respecting me, and walk out. And it had nothing to do with that. It was just I need to cover that I couldn't read this. I didn't want them to know that I'm walking out because I can't read.
So you found solutions that sort of make it work and hide the real problem.
Yes.
So that others won't notice.
Right.
Doesn't that take a lot of your time?
Yes.
Doesn't it take a lot of effort for you?
A lot. Very emotionally. Yeah.
It drains you?
Yep.
Okay.
I am married to an engineer now, and this man has some health issues, so we are in the doctor's office from time to time. We will walk out of the doctor's office, and my husband, with all of that left-brained intellect, will say to me, what did the doctor say? What am I supposed to do? I don't understand.
I'm going to say, well, one of the things that you can do if you have a really bad pain, I mean, where you can't stand on it and it's really getting in your way, is to use what I call, this is my little pain protocol here. It has ibuprofen, which decreases those little cells I was talking to you about, the inflamed part, and your Tylenol that just works on the pain. Yeah. And the I is for ibuprofen and T is for Tylenol. And this just shows you how to do it over the course of the day. For breakfast, lunch, and dinner, there's an I, so you use ibuprofen.
That's right.
Because you have to have something on your stomach.
That's right.
With that one. Because this one will irritate your stomach. Yeah. So in between meals and at bedtime, you use a Tylenol. Right. This way you get something every 3 hours. You don't overdose on either one. So it's IT, IT, IT. And if you do that for a couple of days when it's really bad, then you can just go back to your regular regimen. But this usually breaks the pain pretty nicely. So I know you have a lot of friends with arthritis. How would you explain it to them?
Well, for breakfast, I take I. 10 a.m., I take T. Lunch, I take I. 3 p.m., I take T. I at dinner, and T at bedtime. Is that correct, Doctor?
That's going to work just fine.
Thank you.
Thoughts about this video? What sorts of things? What stood out to you? What were some of the things that? Yes.
It never gets old seeing that. It's a great video. One of the things that stands out is that you can't tell how little you can these people when they have deficiency in their.
Yes. So we looked at the titles of their job titles. We had a deacon, we had a world traveler, a physical therapist, a pharmacy tech. So these people are functioning in society. They're, they're right along there with everybody else. But you're absolutely right. We can't tell. Yes.
Just a profound level of embarrassment that they felt, and so how would you ever get to a point where you can even understand their literacy?
So what we're talking about is shame, and shame is we're going to see there's a really great paper on shame that was written by Nina Parikh, and we'll look at some of the statistics about that, but how shame influences your behavior, and not only just around this sort of thing, but the lengths to which we will go to hide that so that we don't get caught in that particular situation and say, oh, you're illiterate, you can't read. That's like the guy said, that's your worst nightmare, the day that somebody actually figures that out. Imagine walking around with that burden all the time. That's daunting. You're right, it's huge. Other thoughts? Yes?
Well, what strikes me is that health literacy doesn't always relate to education level.
Right.
Like an engineer who doesn't understand certain, kinds of terminology.
Exactly. One of the examples that's been used around this is this notion of imagine, and God forbid this is not the case, but imagine you're in the doctor's office and the doctor comes in and says, we looked at your lab results and you're positive you have cancer. So here's what I can guarantee you, right after the word cancer happens, you're not there. Exactly. What's going to come into your mind? Oh my gosh, am I going to live? What about my family? What's going to happen? Is this painful? How much time do I have left? Your mind's going to go totally away. Whatever that provider says to you at that moment, your health literacy score has just dropped probably by about 80 or 90%, right? Okay, other thoughts?
I was going to mention something really similar related to that is empathy.
Yes.
Feeling empathy for those people, because I've been in that situation where you're told something and your mind goes blank and your doctor's talking, and you're trying to catch up, but you can't.
Right.
Because you have all this swimming in your head.
Yes. And so how do we bridge that until you get over that initial shock, right? And we get to a point where we can actually start having a meaningful dialogue about what our next steps are. What are the expectations? What is your prognosis? All of those sorts of things. And there's a lot of things that, health literacy best practices teaches us. Bring in somebody, a recording, write some things down, all of those. There's lots of different strategies to get around that, but you're absolutely right. Empathy is a huge piece. Anybody else? If you're raising your hand, go ahead, I'm sorry.
No, that's okay. The latter part of the video, I was always taught that a person that was truly educated, not in the mind of the patient, but I'm talking about from the professional perspective, it's not about the 50-cent words that you can use or rattle off, but a person that is truly educated can walk into any setting, regardless if they are a nuclear physicist, and identify with anybody in the room and speak their language. Maybe not foreign language, but speak the language or you can't speak the language, but you find the tools to be able to communicate with that person.
Yes.
So the latter part of the video, I used to be a community health worker, and a lot of my patients would tell me things that they wouldn't tell the doctor. And they'd be like, Brandy, I don't read very well. I'm like, that's okay. They're like, I don't really know how to take my medication. So I would get slack because I would create virtual pill boxes for the patients, write on their medication bottles, like color coordinated. So I'm like, okay, the blue circle is this, and the red circle is this. So we make the pill box with blue and red circles. So I'm like, where to take your medicine and what you should be looking at when you take it. I used to get slack because the doctors are like, what are you doing? I'm like, well, it works for the patients. And they're like, well, everybody's doesn't look like that. I was like, well, I give them the opportunity to design what it's supposed to look like with me, so every individual person understands what it is that they're doing.
So what you're kind of talking about in a way is what we call universal precautions, which is, there's a couple things. So one component of that is universal precautions, which is let's make the assumption that everybody is functioning at a low level of literacy and health literacy. So let's speak very clearly, let's speak slowly, let's test for understanding and comprehension, let's work within the realm of what we understand that person can understand. Another part of what I think you're touching on is a little bit of cultural awareness, getting toward cultural competency and proficiency, because certain people in certain circumstances from certain various ethnic backgrounds, if I walk into somebody's home who is an elderly Asian woman or a young African-American male, the trust factor there and the perception of a difference in culture, and therefore in their mind understanding, might be such that affects the trust that's going to go on there. So if you are, one of the things that we do at IHA is we have a family resource center, which is a social services agency. And we're bringing back one of our programs, which is a promotora program. Is anybody familiar with the promotora program? So these are community workers, such as yourself, who would go out, who are members of that community, share similar background, live in the same area, and that trust factor can be a little bit higher. So some of these things, such as you mentioned about actually acknowledging that they can't read, and that's a huge compliment to you, because as we know, with that shame factor, that's a very difficult thing for people to actually acknowledge and admit. Thanks for sharing that. Anybody else? Okay, yes. Thank you.
I don't know if that final segment, I liked it, the A and the T chart with the meals, but I was concerned because I was like, if they were modeling that as the way we should do it, which was good, individualizing for the patient, that could still cause confusion, because what if his wife buys acetaminophen and Advil? IT, and now you have A in the picture and two A's, which are the I and the T.
Right.
So, it's so important to individualize. That couldn't necessarily be used for everybody. It's really difficult.
No, you're absolutely.
That's one thing that caught my mind.
No, and you're absolutely right. And so that's the whole, really that's the whole point of health literacy, is every single one of us is different. We're all coming from a different background. What works for you may not work for you. And so you're absolutely right. That's something that we need to be very cognizant and aware of. One of the other things that really strikes me about this video is how so many of these people that are in this video took the responsibility and blame onto themselves, right? You heard the woman at the beginning. She said, "I took my medication wrong. I admit it. I admit it." Think about that phrase. When somebody says, "I admit it," what does that mean? You're really saying, I did something wrong, right? I take full blame. I broke the dishwasher, I admit it. I kicked over the lamp, I admit it. It's like, well, wait a minute. There's kind of a shared culpability here in this whole equation. The healthcare system kind of failed you a little bit as well, right? And then the woman who had the hysterectomy, but didn't know that. We had her speak at our conference about 8 or 9 years ago. Very powerful stuff. But can you imagine that? And she used the word stupid twice. Now, she's actually, when it comes to non-academic, non-book related sorts of things, a very intelligent woman. She can speak on quite a bit. She's a world traveler, really kind of knows quite a bit. It's just there are certain areas or aspects that are related to your ability to read and to understand that were a little outside of her thing, but it's that taking on of blame. What I ask for you to do is be aware of that, note that. We can't fix that with a magic wand, but we can understand that this is part of our, what we're dealing with on a regular basis. Be aware, ask those questions, use the tools that we have, okay? All right, pop quiz. Oh, wait a minute, Villaire, you didn't tell us there was going to be a pop quiz. I got it. All right, and if you get the quiz right, you get to leave the room. Okay, so when I get on an answer and you think that's the right answer, raise your hand, okay? Which of the following is the strongest predictor of an individual's health status? So which of these factors can we pretty much best tell how healthy that person is? Is it their age? All right, age, anybody? If older, you're probably not as healthy. Younger, you're healthy. No biters? Okay. Oops, crap. Well, there goes there, spoiler alert, don't look. Walks away in shame. Okay, yes, right. See? Okay, no, actually, okay. So income, so all right, I've already let the cat out of the bag here. It is literacy skills. I love giving, I get invited every year to talk to a group of pharmacy students in a baccalaureate program in Ontario, California here. And I love talking to these students. And I do this one, and I gotta tell you, everybody bites. It's like, oh, age, yeah, okay. Oh, yeah, if you're richer, you're more healthy. I'm like, this is test taking 101, right? We're in a literacy lecture. Of course the answer is going to be literacy. They always do much better on tests after I lecture to them, I'm just going to say. But, all right. So in this statistic, 75% of those who self-reported poor health fell into the below basic health literacy category. Think about that one for a minute. We're going to see this statistic again in just a minute. So here's a couple of health literacy myths, right? So let's do some myth busting. People who can't read can't learn. No, of course they can. Because you can't read doesn't mean that you're not able to learn certain things. We learn all the time. We learn by watching. We learn by doing. Okay? And we learn skills and trades, and we learn how to, bake a cake and fix a flat tire and do all of these sorts of things. Just because we can't read doesn't mean that we can't learn. Another myth, most people who are illiterate are immigrants or minorities. Guess what? Guess who, if you had to take an ethnicity and a gender and a national origin, guess who is in terms of just general numbers, guess who your poster boy is? It's me. White, middle-aged, American, whatever, okay? It's not minorities. Now, within certain groups, there can be a higher likelihood of having limited health literacy or proficiency. But just as a pure number, you're looking at them right here, okay? If someone can't read and I give them written instructions, they'll tell me they can't read. Well, we already know that's not true. We saw a whole bunch of people up here who have literacy challenges, and no, they're not going to tell you. I can tell how well someone can read by the number of years they attended school. Isn't there a book called The High School Teacher Who Couldn't Read? Something like that. People graduate all the time and get through the system with very limited ability. A rule of thumb, just a rule of thumb, and it doesn't apply all the time, but if you had to use just sort of a general rule of thumb, 4 grades. Subtract about 4 grades from how much education somebody has, and there's probably a greater likelihood that that's the more likely number of what grade they're going to read. And here comes my favorite one. Let's just dumb it down. Just stop. Because the more you talk, the dumber you sound. This is not about dumbing down, all right? How many people like tough and complex, turgid language? All right? How many people like simple and easy? Yay, simple and easy. Of course, we're terribly busy. We got a ton of stuff going on. Who wants to stop and try to plow through some, grade 27th level text? Give me simple, actionable verbiage where I can actually just read this stuff, understand it, and move on to the next thing. Dumbing it down is not what we're talking about. We're talking about targeted, simple messaging, separating the nice to know to the need from the need to have, all right? And saying those messages in a way that people can understand them, act upon them, and move forward. All right. So let's take a look at some statistics here. There have been 2 major studies of literacy and health literacy. The 1992 NALS, National Adult Literacy Survey, really just looked at literacy levels, reading ability. So the one we're going to take a look at is the 2003 NAL, the National Assessment of Adult Literacy, because there was an added module on there on health literacy, and that gave us some of the statistics that we use. There are no further NALS studies planned for funding or whatever reason, but the PIAC, which is the program, I finally got smart enough to put this little part, because every year I'm like doing this, I'm like, oh, what does PIAC stand for again? So finally I wised up. The Program for the International Assessment of Adult Competencies, and there's the URL. And this is in your material, so don't worry about copying that down right now. Literacy levels, 4 levels: below basic, basic, intermediate, and proficient. Okay. In the NAL study, here's the findings. The percent of the U.S. adult population with below basic or basic skills, so the bottom 2 categories. In prose literacy, which is sentences, paragraphs, just reading text, 44% of the adult population fell into the bottom two categories. Prose literacy, just reading text, reading sentences. Document literacy, this is your ability to find a piece of information on a form or a chart, a bus schedule, a dosing chart, okay, something where you use the x-axis and the y-axis or find information in a box somewhere. 34%, about 1 in 3, fell into the bottom two categories. And here's the kicker. Quantitative literacy, also known as our old friend numeracy. As we said, we were going to look at this again. 55%, more than half of the adult population falls into the bottom two categories. So when I asked you a little earlier on who was good at math and you didn't raise your hand, you can feel a little bit better about yourself because you're in good company. More than half of us fall into the bottom two categories when it comes to our quantitative literacy or our skills in numeracy. All right? So now let's look at health literacy. 36%, or a little more than 1 in 3 U.S. adults have limited health literacy skills. 22% fell into basic, 14% fell into below basic. Only about 12% are considered proficient. Let's stop on that statistic for just a second. So what we're really saying is about just a little bit more than 1 in 10 U.S. adults are considered proficient in health literacy. And when we frame that for context, let me ask you a question. How many people think the healthcare system is simple? All right? Healthcare system's pretty stinking complex, isn't it? I mean, we've got terminology, let's just start talking about health insurance, all right? And that's just your doorway into the healthcare system, all right? And then let's talk about what happens in an emergency. How about trying to take care of a chronic disease, diabetes? How simple is it to take care of diabetes? Not very, okay? So when we consider only about 1 in 10 Americans are considered proficient in health literacy, we can probably make a distinction here and say, in order for you to function effectively within the healthcare system, you probably need to have proficiency, be proficient in health literacy. And that distinction only falls upon 1 in 10 of us. And because I'm guessing probably the majority of people in this room probably fall into that proficient category, that means we've got 9 other rooms of people with exactly this same number of people who are less than that. The majority, or 50%, had intermediate health literacy levels, which is like, okay, I can deal with some of this, part of this. And no big surprise here. Women's health literacy score is 6 points higher than men. 4% more men were in below basic. So take that one home and tell them to your spouse, all right? There's a little zinger for you. Who has poor health literacy? Now, when we talk about some of these particular groups, we are not saying everybody in these groups have limited health literacy. What we're saying is that the likelihood of people within these particular groups can be a little bit higher, that those people in those particular groups have basic or below basic health literacy. So those who are 65 and older, nearly 60% of the people in that age group fall into the bottom two categories. Does not mean if you are older than 65 that you have limited health literacy. It just means there's a greater likelihood of that being the case, all right? If you take your health insurance from an employer, you would tend to have higher health literacy. If you are using Medicare, well, Medicare not so much, but Medicaid, or you have no health insurance, probably a greater likelihood that you have lower health literacy. Hispanics, though they represent about 12% of the adult population, represent 35% of those in the below basic category, so a little overrepresentation there. Same thing on those who are living at or below the poverty level. That's about 17% of the U.S. adult population, but they represent about 43% of those in the below basic health literacy category. And then our statistic that we saw before, about 75% of those who self-reported poor health, they said, my health is pretty poor. About 75% of those fall into the bottom category in health literacy. A few more statistics. About 1 in 2 Americans can't read above the 8th grade level. This is just what it is. Let's remember that. When we're producing materials and we test them out, in addition to actually testing on for real people, which I very strongly recommend, let's do a grade reading level assessment as well. 8th is still too high, frankly. 6th grade, 5th grade, really try and shoot for that if you're producing materials. Most patient education materials written are beyond the recipient's ability to understand. That's just what the literature tells us. Now, From an AMA study, here's what they found. 26% of people could not understand when their next appointment was. 42% could not understand take this medication on an empty stomach. And 60% could not understand a consent form. I think that number is low, frankly. I think most consent forms, unless you work with people who are going to be at this conference, somebody like a Chris Trudeau or somebody who actually is a lawyer and works within the health literacy space, imagine that. Actually, those consent forms are just dense and undecipherable. And when are you signing those? Like when you're on the gurney and going into, oh, can we do this? Is this okay? Well, no, wait. All right. And you're already kind of on the way in. They got the mask. Maybe not quite that bad, but okay. A few other things to stir in here. 381 languages that are spoken or signed in the United States. As of 2013, 40 million foreign-born people living in the United States. 60 million Americans, that's about 20%, speak a language other than English at home. 24 million Americans, about 8%, have limited English proficiency, right? And this is probably the most onerous one of all. 75 to 90% of patients in the 2 lowest reading levels describe themselves as being able to read or write English well or very well. 75 to 90%. So of course this is that issue of shame. Of course we're not going to say, oh, I'm a pretty terrible reader. No, you're not going to say that. Cognitive impairment, this can have an effect upon our ability to understand. Hearing and visual impairments, right? Medications, that's going to change kind of our ability to understand and focus in certain circumstances. The one we talked about before, stress, and the fact is about most people forget at least 50% of what the healthcare provider told them the second they walk out that door. And then shame, this Nina Parikh study. Shame and illiteracy or limited literacy, 78% thought they should hide it or just cope with it. 77% never told their doctors. 67% never told their spouse. 2 out of 3 people who were essentially functionally illiterate never told their spouse. And 19% just never told anybody at all. That's shame. That's the power, the motivating power of shame. All right? Doc, enough with the English. Just give it to me in plain academic medical terminology. This happens all the time. Right? Okay. So why does health literacy matter? That's really kind of why we're here. Because those with limited literacy skills report poorer overall health. They have poor ability to manage chronic disease. And we're going to put that one aside for just a quick second. They tend to have poorer outcomes. They're less likely to understand their diagnosis, less likely to have screening and preventive care, which means they're tending to present in later stages of disease. And what does that mean? That's going to cost more, right? In terms of their time and their cost, as well as resource utilization from the system. They are more likely to be hospitalized, and when they are discharged, they are more likely to be re-hospitalized. All right? So cost, let's get right down to brass tacks, right? Why are we here? Let's follow the money, the ROI, the bottom line. That's the important thing, right? Friedland and Associates in a 2003 study showed that about $73 billion was spent unnecessarily each year on healthcare costs, directly attributable to limited health literacy. Another study by Vernon and colleagues, and people will quibble with these studies, but I think in general there's value to these particular studies. $106 to $238 billion spent unnecessarily each year because of limited health literacy. And then we add in chronic disease, all right? 1.7 trillion, or about 75 cents of every healthcare dollar is spent on chronic illness. 1 in 2 Americans live with a chronic disease. So we're starting to see some of these dots get connected here, right? And 90% of those age 65 and older have a chronic disease. 77% of them have 2 or more. And what did we learn in one of the previous slides? People who are 65 and older tend as a group to have one of the lowest levels of health literacy. So if people as a group have the highest burden and the highest incidence of having a chronic disease, which is difficult to understand, yet they are ill-equipped to manage that because they have limited health literacy, what have you got? You've got a recipe here for additional resource utilization, higher costs, because people aren't understanding how to manage that disease, and so therefore they are into the healthcare system much more often. And 70% of deaths annually are due to chronic disease. So chronic disease accounts for most of our healthcare expenditures, and yet the ability for people who have, the people who have the greatest incidence of those chronic disease are the least likely and least prepared to be able to take care of those accurately. We have a role in that. So a couple of websites here and things that you can go to, but I think we're right around time here. Wow, how about that? I don't think that's ever happened in my entire lifetime. Quiet. Quiet. Thank you. All right, I'm a Luddite. I'm sorry. Hold on. Thank you. Thank you very much. Any questions? I know we kind of were trying to do those as we went along, but any general questions? Thank you. You're very kind. I appreciate that. Anything else? I'm going to stick around for a few minutes. Thank you so much for your time and your attention here. If you have any questions, like I said, I'm happy to answer those. I hope you guys have a fabulous conference. We've got 2 days of really wonderful stuff. We'll be in here tomorrow at 8. Breakfast is in the tent over there at 7. Have a great evening. Enjoy. Thank you very much. Thank you.